Here's a message to the Centers for Disease Control and Prevention, popularly referred to as the CDC. Stop playing politics and focus solely on public health. Hello, I'm Steve Forbes, and this is What's Ahead, where you get the insights you need to better navigate these turbulent times. The CDC is supposed to be our frontline defender and warning system when it comes to diseases, particularly new ones like COVID-19. We count on the CDC to identify potentially lethal threats and deal with them decisively before they become pandemics. With COVID-19, the World Health Organization failed miserably, taking dictation from China where the virus originated. But the CDC and the FDA also fell short with deadly consequences, both in recognizing the magnitude of the threat and botching initially efforts at testing. In the months before the crisis, the CDC's website was focused on not infectious diseases, but climate change. This was political pandering. There are plenty of organizations, not to mention government agencies, concentrating on climate change. Again, the CDC's specialty, its value added, is uncovering and curbing potentially pandemics. But its unfocused behavior continues. On its own, the CDC imposed a sweeping moratorium on residential evictions for non-payment of rent. That's the purview of Congress, which had previously enacted a temporary one, but chose not to renew it because the economy is opening up and recovering. The Supreme Court recently ruled the agency had no constitutional authority to do this and voided it. When it comes to recommendations for schools, the CDC has been bowing to the dictates from the teachers' unions, rather than following real-world evidence, starkly contrary to what other countries have been doing. Back in March, CDC head Rochelle Walensky declared that fully vaccinated people, and I quote, do not carry the virus at all, end of quote. Oops. The outdoor spread of COVID is a small fraction of what the CDC said it was. The CDC's advisories on the Delta variant don't reflect real-time data coming from the UK, Singapore, and Israel. The CDC is now weighing in on gun violence, another example of its lack of focus and political pandering. Once more, countless other parties are tackling this issue. It even found time to issue a guide on new ways to communicate more inclusively. No-nos include using the word elderly. Instead, call us elders or older adults. That sure makes me feel younger. Don't call someone a prisoner or inmate, but rather person who is detained. Earlier this year, CDC Director Walensky said, I'm going to reflect on the recurring feeling I have of impending doom about COVID. Too bad she and her agency haven't effectively reflected that urgency and focus. I'm Steve Forbes. Thanks for listening. Do send in your comments and suggestions. I look forward to being with you soon again.